Have you ever experienced pain in your joints that doesn't seem to go away? Or maybe you've had headaches that just keep coming back, no matter what you do? If so, you're not alone. Millions of people suffer from rheumatoid arthritis, or RA, a disease that affects more than just your joints. In fact, it can cause headaches, dizziness, and a whole range of other issues that many people don't even realize are connected to their arthritis. Now, here's where things get tricky. If you're dealing with RA, you're probably already battling joint pain and swelling on a regular basis. But what if I told you that the same condition attacking your joints could also be the reason you're experiencing headaches? Even dizziness? That's right, the very thing you're treating your joints for might be affecting your brain as well. The surprising connection, RA and headaches. You see, RA is an autoimmune disease. That means your immune system, which is supposed to protect you, is actually attacking your body's own tissues. Normally, RA targets the synovial tissue that lines your joints, leading to pain and swelling. But here's the kicker, that inflammation can spread beyond your joints. It can also affect your organs, including your brain. One study in 2018 found something really interesting. Chronic inflammation from RA can mess with the way your brain functions. It changes the brain's connectivity patterns, which could explain why some people with RA also experience headaches. It's like your brain's wiring gets scrambled because of the constant inflammation in your body. And then there's the neck. Cervicogenic headaches, a fancy term for headaches caused by problems in the spine, are common in people with RA. If your RA has damaged the joints in your upper spine, specifically around the C1-C2 vertebrae, it can cause pain that starts in your neck and radiates to the back of your head. It's no wonder you're reaching for the painkillers. RA's hidden villain, vasculitis. But it doesn't stop there. RA can also lead to something called vasculitis, which is inflammation of the blood vessels. When this inflammation cuts off blood flow, it can damage the brain, nerves, and spinal cord. That's where things can get scary. Vasculitis affecting the nervous system can cause chronic headaches, confusion, vision problems, and even muscle weakness. Let's not sugarcoat it, vasculitis can lead to some serious health issues. We're talking about brain aneurysms, seizures, and blood clots. These are the kinds of problems that don't just mess with your day, they can completely disrupt your life. And that brings us to another important point. If you're experiencing severe, long-lasting headaches, they could be a sign of something bigger, like vasculitis. So, it's critical to talk to your doctor right away. Migraines and RA, a painful double whammy. But wait, there's more. Studies suggest that people with RA are more likely to develop fibromyalgia, a condition that's known for causing chronic headaches, migraines, and a lot of other symptoms like fatigue, depression, and anxiety. If you're living with RA and you've also been diagnosed with fibromyalgia, it's like fighting two battles at once. Migraines are another curveball that gets thrown into the mix. A 2017 study found that people who suffer from migraines are at higher risk of developing RA. Migraines can cause sensory changes like flashing lights, one-sided head pain, nausea, and even vomiting. These headaches are no joke, and when combined with RA, they can feel downright unbearable. RA treatments, the double-edged sword. Now, what's ironic here is that some of the treatments for RA might actually cause headaches themselves. Corticosteroids, which are often prescribed for RA, can cause headaches and fatigue, especially if you're on a high dose. Disease-modifying anti-rheumatic drugs, DMARDs, which are supposed to slow the progression of RA, have their own list of side effects. Some, like anakinra, cyclosporin, and hydroxychloroquine, are known for triggering headaches. And then there's everyone's go-to pain reliever, nonsteroidal anti-inflammatory drugs, or NSAIDs. Sure, NSAIDs like ibuprofen can help with mild headache pain, but if you take too many, you could end up with what's called a rebound headache. It's like your body becomes so used to the medication that stopping it suddenly makes the headache worse. Is it RA or something else? The tricky thing about RA is that it shares symptoms with other conditions. Headaches, for instance, can be caused by many things, not just RA. Infectious arthritis, which happens when an infection spreads to the joints, can cause headaches, fever, chills, and joint pain. And then there are other autoimmune diseases, like Lyme disease, which also cause headaches. It's important to remember that not every headache is related to RA. But when you're living with a chronic disease like RA, it's easy to assume that every new symptom is connected. That's why it's so important to stay in close contact with your healthcare provider and let them know about any new or worsening symptoms. Managing RA-related headaches, what you can do. So, what can you do if RA is causing your headaches or making them worse? First, if you're dealing with migraines, try to avoid triggers like caffeine and alcohol, keep a regular eating and sleeping schedule, and practice stress management techniques like yoga or deep breathing. Small changes in your daily routine can make a big difference in how you feel. If your headaches are related to your neck and spine, like cervicogenic headaches, physical therapy might help. A therapist can teach you exercises that strengthen your neck muscles and relieve tension. Massage can also work wonders for this type of pain. Now, if your headaches are related to vasculitis, you'll need something stronger. Steroids are the go-to treatment for vasculitis because they reduce inflammation quickly. In more severe cases, your doctor might recommend nerve blocks or pulsed radiofrequency therapy, which targets the nerves directly. And for those of you dealing with migraines, there are medications that can help prevent them. Anti-calcitonin gene-related peptide injections, or anti-CGRPs, are a newer option that's been showing promise in preventing migraine attacks. When to seek help? Let's be real, not every headache is a sign of something serious. But if you're experiencing severe headaches that just won't go away, or if they're paired with other symptoms like vision changes, dizziness, or numbness, it's time to seek medical attention. RA-related vasculitis, for example, can lead to brain aneurysms or strokes if left untreated. If you suddenly experience a sharp headache, stiff neck, seizures, or confusion, don't wait, get to the emergency room. These are signs of a medical emergency that require immediate treatment. Conclusion: take control of your health. Living with RA can feel overwhelming, especially when it starts affecting more than just your joints. But here's the good news: with the right treatment, you can manage your symptoms and prevent complications. Whether you're dealing with headaches, dizziness, or joint pain, there are solutions out there that can help you feel better and live a full life. Don't let RA define you. Keep pushing forward, stay informed, and work closely with your healthcare provider to find the treatments that work best for you. Because at the end of the day, taking control of your health is the best way to manage RA and its many challenges. And remember, you're not alone. Millions of people are walking this path with you, and together, you can find relief.